You're watching PCTV Channel 17, proudly serving the Port Clinton City School District community. The following is a production of the Port Clinton High School Digital Media class.
Welcome to Time for Health. I'm your host, Rachel Fall, and we're very glad you've joined us. We hope you gain something from the program that helps you and your loved ones. We want to arm everyone with as much information as possible so we can all make good choices. This is not to take the place of regular medical care, so be sure to include your healthcare provider in on your plans and your conversations. And today, we are talking about the health of our community as a whole, or our community health assessments that we've done over the years. We have two guests with us. Thank you, ladies, for being here.
Thank you for having us.
Emily Golias, you're with the Hospital Council of Northwest Ohio, and Nancy Osborne, our health commissioner. Thank you again.
Thank you.
So this is one of those things that kind of happens a little bit behind the scenes, a lot of work behind the scenes, kind of a mandated thing, but a good thing to do. So talk a little bit about Ottawa County's community health assessment, the history of it.
Okay. Well, the Ottawa County Health Department, as one of its core functions, is responsible for assessing the health of the community on a regular basis, typically approximately every 5 years. So actually, we are embarking right now in 2017 on our fourth community health assessment. The first one was in 2001. We had a second in 2006. The last completed one was 2012, and actually we've just wrapped up our action plans from that, and now we're moving forward with a new assessment for 2017, for which we will then move forward and develop what's called a Community Health Improvement Plan. The Community Health Improvement Plan is based on the findings that the assessment produces from the questionnaires and other data that is collected, and Emily will talk a little bit more about that. Okay. We don't do this alone. The health department doesn't do this alone.
Sure.
It has what we call Ottawa County Health Partners. It's a kind of a coalition or a group of agencies, representatives. Actually, the Port Clinton City Schools is a member. Magruder Hospital, United Way, Probate Court System, Riverview Nursing Home, Riverview Healthcare Campus, the Erie Ottawa Mental Health and Recovery Board. Of course, the Ottawa County Health Department is the lead agency. Ottawa County Department of Job and Family Services, Senior Resources, and the Ottawa County Board of Developmental Disabilities, DD.
Okay.
So it's a collaboration of many agencies. This past year, when we developed our community health partners for the 2017 assessment, we included law enforcement. And so we are very fortunate to have the Ottawa County Sheriff and the Port Clinton City Police Chief join us, and they were very instrumental in assisting us in developing the questionnaire that goes out.
So it's not something necessarily that you do just on your own, but it's very much a community-based, a collaborative effort with all the agencies that interact with all the members of the community.
Absolutely,
okay.
Yes.
This might be boring for some people, but this is something that you have to do. You're mandated to do it.
Right, it's part of public health standards and performance standards, and our mission to assess the health of the community, to identify what the health needs are, and then our responsibilities are is to put together a plan to address
those. And that's where all those other entities come in, because it might come up that mental health is a major issue, or developmental disabilities is in need of something, and so that's kind of where everybody pitches in something.
Exactly.
And the data benefits everybody as well. Everyone who's involved, everyone has a piece of the puzzle and can use this data for various programs, grant funding, whatever you can think of to use it with, it's available.
Okay. So Emily, talk a little bit about the nuts and bolts. The Hospital Council of Northwest Ohio kind of helps implement the survey? Talk about how it's developed, how it's completed.
Absolutely. So in terms of how the survey is developed, what we have, we bring all those community partners that Nancy just mentioned together, and everyone sits in the same room, which, as I'm sure people know, it's very hard to get a lot of people in the same room at the same time working towards the same goal. However, in Ottawa County, we managed to do this very well, thanks to the help of the health department. And so we get everyone in the same room and we talk about what kinds of questions that we want to ask and which kinds of populations that we want to collect data on. So for the 2017 health assessment, as well as the health assessments that have happened previously, we want to collect population health data on adults and youth that reside in Ottawa County.
Okay.
So we bring all these people together and we look at health trends that have been happening in the past several years in Ottawa County. And these health trends range from alcohol use to tobacco use to personal health, safety, violence, nutrition, physical activity, everything that is really in the realm of health. And we look at these trends that have happened in the past and try to figure out what we want to ask this round so that we can get a better idea of the overall health in Ottawa County. Afterwards, we finalize the questionnaire, and then in terms of how the actual surveys are administered, they vary between the two populations. So I'll start with adult.
Sure.
So with adult, we typically have about 115 questionnaire, and while that might seem daunting to some people, it usually only takes about 20 minutes to complete.
Okay.
So we mail that out in 4 waves. So the first wave is called the advanced wave, and that is when we take a mailing list that we receive at complete random and we mail a letter to future participants in the survey. This letter lets the residents of Ottawa County that they may be selected to participate in this survey, talks about the survey, the benefits of the survey, and why it's important to collect health data in the county. We then send another wave, which we call the first wave, at random to 1,200 adults that reside in Ottawa County. The actual first wave consists of 1 survey, a letter describing the survey, a $2 incentive, and a paid postage return envelope. That way, whoever is completing the survey, they can use that money as kind of a gift to, have a beverage or, something while they're completing the survey, and then obviously the postage so that it costs them nothing to complete the survey and mail it back in. We then do 2 more waves of that, so they receive a copy of the survey again, and then the last is a postcard. So we really urge Ottawa County adults to really consider taking the survey. That way the data is completely anonymous, it's confidential, and it's group data. So in terms of the questions that we're asking, we're not really interested in knowing who is engaging in what kinds of behaviors. We just want the data as a whole so that we can kind of get, again, that big picture idea of the health status. For the youth, it's a little bit different. We go into the schools and we administer the survey similar to what the Centers for Disease Control already does. Okay. And I'll mention that a little bit. So the questions that we usually select for both the adult and the youth surveys come from a national survey that already exists. For the adults, that is the BRFSS, and for the youth, that is the YRBS, which is the Youth Behavioral Risk Surveillance Survey. So when we go into the schools, we administer it, and we choose schools schools and classrooms at random. Okay. So in Ottawa County, we're doing 4 school districts currently, and we receive the approval of the superintendents. Once we have the approval of the superintendents, we connect with the principals, who will then choose the actual classrooms at random. We survey grades 6 through 12, and the survey is usually about 70 questions or so. Again, seems like a lot of, very time consuming and a lot of questions. However, again, it will usually take the average student about 20 minutes. Okay. And then once we're done, we take all the data from the youth and from the adult, we compile the data, and we actually scan it through a scanning machine that will then put all the data from the surveys into a nice spreadsheet. Once we do so, we send that data, we clean it, and we send it to our statistician. And for those of you who might not know what the statistician does, he kind of runs the data. And what that means is that there's various statistical tests that he can run so that we can make sure that all the data that is collected can be representative of the entire community. Okay. Once we're done, we write the report, and then we come back to the health partners and we look at the report. We kind of, try to figure out if there's any other, are there any gaps in the report? So, perhaps if we asked a certain question, but we want to see, what's the percentage of adult drinkers who may be engaged in a certain other behavior. We can run those statistics and include those in the report as well.
Okay. You said the group comes up with the questions ahead of time.
Yes.
Have the questions changed over the years? I kind of, a little bit a part of the process. I noticed the questions were the health questions aren't just about diabetes and heart disease and that kind of stuff. They're about a lot of other things. Has that changed over the years?
Yes and no. So it really depends. We try to keep the questions rather similar to previous health assessments because we want to get what's called trend data. Right. And so the importance of trend data is that's how you know if you've made a difference in your community. So Nancy talked about creating a health improvement plan after having a community health assessment. Well, you're not going to really know if you made an impact in your improvement plan if you don't have data to measure your progress.
So you have to ask the same.
So we ask similar questions, and those are questions that come from the Centers for Disease Control and Prevention.
Okay.
And the reason why we ask those questions is so that we can take Ottawa County local health data and we can compare it to state data as well as national data. That way you can kind of see where, how you compare it to the state and the U.S.
Gotcha. You mentioned that the surveys are anonymous.
Yes.
They don't all go back to Nancy and that. They go to a third party or somewhere else. They're just all compiled and fed in that way.
They're compiled in an envelope and then into a scanning machine. That way there's no way for anyone to know.
Same with the youth, even though they're doing it in person.
The youth are doing it in person. Yep.
Send it.
Yep, absolutely.
Okay, so that kind of assures some anonymity and confidentiality and all that good stuff.
And we do encourage youth, there are some sensitive questions on both surveys and it's completely optional. So if there's questions on there that perhaps youth or adults maybe aren't comfortable answering or don't want to answer, they don't have to. They can go ahead and skip it and go on to the next one. It's completely up to them.
Okay. And they get passive permission slips from the school for the youth one as well?
Yes, they absolutely do. So we want to have parent consent and we also mail those home because, with some, and it really depends on the grade level. Sometimes if you give a parent permission slip, it might not always make it home to the parent, in the backpack of a student. So we always mail those home to the parents to ensure that they receive them. That way there's transparency in terms of the survey.
Nice.
And at the request of the parents, if they wanted to know more information about the survey, they could actually call the school. We will eventually provide the school with a copy of the survey. The parent can look over the survey, and if that's something they decide that they want to have their student participate in, then they can, allow them. And if not, then they can turn in the passive permission slip.
Okay. So this is all kind of the background part of it is getting that group together, coming up with the questions, mailing out the survey, going into the schools. It's all random and that kind of stuff, and then we're about to take a quick break and we can kind of talk about what we do with all that information afterwards and who all is involved in that process. I got it about right?
Yeah.
All right, we're going to take a quick break and we'll be right back. And we're back talking about the health of our community health assessment with Emily and Nancy. We talked in the beginning about the how it's developed and the written survey that's mailed to adults and done in the schools with the youth randomly and anonymously. But there's something called secondary data that you guys also can kind of put into a report. Tell me about that.
So secondary data is something that we compile from other sources. So the way that is different from primary data is the data that we are actually collecting from Ottawa County residents. So primary data is from Ottawa County residents, very local data that we collected ourselves. Secondary data is data that we collect from various other sources, and that can be from agencies such as United Way. It can be data sources that we might get from the health department, such as live birth statistics or death statistics. It could also be data that we may obtain from the state. It could be data that is national data. And the reason why we include such secondary data is because the primary data that we collect is great, but it's not very useful if you don't have a frame of reference or any kind of context. So for an example, if we're looking at how many fruits and vegetables the average youth might consume on a daily basis, well, we don't really know if they consume, if they consume 5%, well, we don't really know, how that's doing against state or national data. They can be doing really poorly against the state, or they can be kind of on par. Same thing if we're looking at drug use, in adults. We don't really have a frame of reference. If 5% of Ottawa County residents, were engaging in such a behavior, we wouldn't really know, if that's significant unless we look at perhaps the state rate or the U.S. rate, or we can even look at other sources that might come from other state agencies, kind of giving us an idea of perhaps how many doses are given per county.
Okay.
So that's the benefit of having it.
Okay. So it's additional information. So we get this report. It's a big honker with lots of information, lots of data. What happens after that? Either one of you. You get your group back together, I know that.
Right. We reassemble the health partners, and we review the data. We launch the report.
We have a whole community event.
Yes. Go ahead.
Okay.
Describe the event.
So the event is something that we try to have in Ottawa County to really get the community engaged in the data that we've collected. It'll give the entire community a sense of, what are the strengths of Ottawa County? What are perhaps some of the things that we could work on to really improve the health of Ottawa County? And so at that event, we talk about specific data points. We talk about, the trend data, how it compares to the state and the U.S., and then we talk about potential next steps. And if anyone who attends the community event would like to be a part of that planning process, then Nancy is the point person they could contact, and then we reconvene the community again to get started in that community health improvement process.
Gotcha. So that rollout of all this information is open to the public?
Yes.
Okay. And want people's input, want their observations, some ideas. Is that kind of the step where we narrow things down? There's 50 different subjects that we ask for information about, and now we kind of narrow it down to a few things?
To a few things that perhaps, might have, out of, all the data that we've collected, what are some of the things that jumped out at you? What are some of the things that you are perhaps maybe an issue that the community didn't realize was? I mean, that's the importance of data. Right. We have our own community perceptions about what might be going on around us, but the great thing about data is that, not everyone is willing to share information about themselves, but with an anonymous survey, we can collect that kind of data, and then it's like, oh my goodness, like this health behavior is actually way worse than we thought. Or on the inverse, we can say, oh my gosh, like perhaps, this health behavior is actually a lot lower than our perceived notion.
Okay. And then you can kind of narrow it down. Is there, if I remember right from years past, there's a point where we kind of get together and look at what programs are available, what gaps there are, talk about that whole process? Well,
after the community health assessment is completed and rolled out and some input gathered from it, we assemble health partners and others to become part of the community health improvement plan, a whole nother process in which we focus on the highest priority needs, healthcare needs. We have at the table all kinds of providers, many of which were part of the development of the community health assessment, and we then start identifying the highest priorities, and with that, what resources do we have to meet those healthcare needs, and where are our gaps? What don't we have? What is a serious healthcare need right now? Everywhere we're talking about the opiate use, and and we'll probably be able to find out how significant that is through this health assessment in our county. So this health assessment is really quite timely with a serious community health problem that we're dealing with. So, but that's just like one example. And then the committee and the people who are engaged in trying to address these healthcare needs work together to come up with a health improvement plan. How are we going to move forward to improve the health of the community?
So some action steps, some programs.
Exactly.
Yeah, so just to kind of give a little more detail as to what that might look like. So again, like Nancy mentioned, we'll reconvene. We'll have a whole other process called the community health improvement process. So like I mentioned, we kind of try to narrow that data down. So we try to see, okay, perhaps what are the biggest issues that might be occurring in Ottawa County. So, and just to give complete made up examples, so let's say alcohol use, drug use, and then perhaps obesity might be an issue. So those would be the 3 priorities that Ottawa County could potentially focus on if those were the priorities that they chose. From that, we'll look at a variety of different things. So we'll look obviously at the data, and we'll try to find actual data points to measure. Afterwards, we'll do various assessments. So we'll do a community themes and strengths assessment, talking about what makes you proud of your community. What are the 2 to 3 most important things that you think makes a healthy community? What are some community action steps or programs that you would support? What are some of the things that you might need, such as grant funding or more collaboration, more personnel? Another assessment that we do is what's called the forces of change. So this is something that we try to think of in terms of what external forces might affect the health of Ottawa County in the next coming years. So this can be social changes, environmental changes, technology changes, political changes. These are all things that we try to take into consideration so that while during the planning process, we can kind of account for that when determining the priorities that we want to work on. Afterwards, what we do is we look at best practices and we look at potential gaps. We look at our resources. So, it's very easy, especially in a county the size of Ottawa County, to have different agencies working on the same thing but not working together.
Right.
Whereas if we're working towards the same priority, you can bring personnel together, you can bring funding together, you can all work towards the same direction. Whereas if people are working on the same thing, they might be working in opposite directions because they don't know about the resources what the other person's working on. They can't combine resources. After we look at the resources, then what we do is we look at potential gaps. So where are the gaps in the resources that we have? What is something that we can do better? And then what are potential strategies that we can come up with to kind of bridge that gap? And then from there, we look at those best practices that I mentioned, and then we come up with action steps to address those priorities that Ottawa County would want to work on over the course of the next 3 years.
And one of the things that's helpful in that process is the ability, the help that the hospital council provides to look at best practices. If I looked at obesity, I'd think, well, let's have, more farmers markets. Well, maybe that's not the answers. How do you find that stuff, or what are your criteria?
So basically, Hospital Council is fortunate enough to work in a variety of communities across the entire state. So we work in about over 40 counties in the state of Ohio. So what we do is we look at what is Ottawa County already doing, because we don't want to recreate the wheel. We don't want to, not utilize the resources that are already available. So for example, if farmers markets were something that you were doing, however, maybe not a lot of people know where they are, a potential action step would be, let's make a map of all the farmers markets in the area, their hours, their information, and disseminate that to the public.
Gotcha.
But in terms of how we find what best practices to use, we try to look at other counties that are similar to Ottawa County. And the way we do that is we look at the demographics, we look at the population size, we look at the kinds of agencies that are in that county. And so we look at similar counties and we see, okay, well, what's working well in this county that we think might be actually feasible to implement in Ottawa County. Okay. So we look at those, and if they're evidence-based, that's great, because that means obviously there's a history of them working. And the great thing about community health improvement plans is that if Ottawa County wanted to do one of those best practices that we suggested, they could. However, a improvement plan is a living document. So if they find, this really isn't working, it may have worked in a county similar to ours, but it's not really working for us, they can change that and perhaps work on something else if they would like to.
So it's not something we're doing this, we have to do this, the other thing, things can change.
Yes, those are very flexible, because the county changes, the community changes over the course of time. So if something that maybe worked in the past or was working in another community worked really well, that's not necessarily to say that could work in 2017 in Ottawa County. So we're very open-minded in terms of best practices and what action steps to implement in the community.
And then the process after that, all that is kind of figured out, and the group sits down, if I remember right, and kind of, we'll take part in the obesity part of it, and we'll help with this initiative or whatever. Is that kind of, and then following up with people?
That's exactly right. It's an ongoing process with meetings and setting goals and reporting back.
Right. And again, like Nancy mentioned, it's not, just the Ottawa County Health Department that does this. It could be, the health department, it could be the hospital, it could be the schools. So for example, or it can be a collaboration of all three. So if obesity was a priority that they wanted to work on, we could say, okay, well, we wanted to address obesity in adult and youth. So perhaps the health department would work with the schools to implement some kind of obesity strategy to youth. Perhaps the health department might work with the hospital to do various obesity programs, such as like Walk with a Doc or something with farmers markets, like you mentioned earlier. So it's a collaboration, and sometimes work groups are created to kind of like tunnel in on those issues, so that way it's not just everyone picking priorities and just working on them at random. We have accountability. Gotcha. And that's something that's very important when you're trying to change, or not change, but improve the health status of a community.
Gotcha. So this is a lot of work that goes into this initiative. And it takes time, like, the assessment, the survey part of it is done every 5 years. Things may be changing or whatever, but it's done periodically, because in a year you're not going to maybe significantly impact obesity or drug use or whatever you decide to work on.
Yes, that's very
easily.
true. Yes. So that's why, and every community is different. So I believe like Ottawa County right now is on a 5-year plan. Some communities are on a 3-year plan. The nice thing about the plan that Ottawa County is on right now is that you're absolutely right. So if something we're trying to work on, like obesity, is an issue, you might not see a change in 2018. You might not see a change in 2019. However, in 2021, you might see that obesity was reduced, 9%. And so that's the nice thing about these kinds of health improvement plans. And some changes, like for example, programs are really great in terms of trying to encourage people to change their health behaviors. However, some action steps that might be in these plans could be system changes or policy changes. And oftentimes you won't see changes like system changes like that for quite some time. So in 5 years, if Ottawa County wants to do this again, they might not see a change at the policy level. But in 10 years, then perhaps Ottawa County is a much more walkable and bikeable community.
Gotcha.
As an example.
Gotcha. Well, thank you very much. Very complex, very important,
Yes.
Lots of involved. So if anybody gets a survey out there, make sure you fill it out.
That's
right?
absolutely
Very important.
right.
Thank you for your time.
Thank
Thank
you.
you.
Okay, we're going to take a quick break and we will be right back. And we're back. I want to thank our guests for being here today, talking about the community health assessment, the health of our community, how we figure that out, and what we do to help the health of the community. If you have questions about the health assessment or anything that we've talked about today, you can reach the health department at 419-734-6800. If you ever have feedback about a program or a suggestion for a future episode, please let us know by sending a note to Time for Health, 615 Fulton Street, Port Clinton, Ohio, 43452. Or you can email Mrs. Pelz at the high school, cpelz@pccsd-k12.net. So think about all that we talked about today on the topic of community health and how you can help, how you can be involved. Certainly if you've gotten a survey, make sure you fill it out, be part of the process. And until we meet again, I encourage you to make time for health.